All right, you can't look on social media without seeing something about Botox and fillers. The problem is that there is tons of misinformation out there about both of those things. So this show, what we're going to talk about is what you need to know and why. Hi, and welcome to the Trillium Show. I'm Dr. Jason Hall, board certified plastic surgeon, author of the new book, The Art of Aging, which is out on Amazon. Got a link in the description below. One click and you're there. So Botox and fillers are hugely popular in the non-surgical aesthetic world. There are med spas opening on every street corner. You can buy this pretty much anywhere from almost anybody, especially you live in the state of Tennessee where we don't really have laws about who can and can't inject. Pretty much anybody can do it, as long as their supervising physician lets them, which means pretty much anybody can do it. So what do you need to know about Botox and fillers? You know, there's a lot of myth out there about it, and why. So one of the big myths about Botox specifically, which is botulinum toxin, there's a bunch of different, Botox is kind of a brand name. It's Allergan's name. It's kind of become the Coke of the neurotoxin world. There are other ones out there, Dysport, Jeuveau, Xeomin, you name it. But what do? What they do is they soften lines and wrinkles, specific lines and wrinkles, by weakening the muscles that cause them. So they're not a treatment for every line and wrinkle out there. They're only used to treat lines and wrinkles that are the result of motion. So think crow's feet, think forehead lines, think your 11 lines. We can use them in other parts of the face to do different things, you know, kind of boost a droopy smile temporarily, but the crow's feet, 11s, and forehead lines really are kind of where Botox shines. So it does not erase all lines and wrinkles. You've got to go back, listen to the podcast. We're talking about the different kinds of lines and wrinkles, and you can hear about the what's and the whys of that one. But Botox isn't just for lines and wrinkles. We use it for all sorts of different things. It's used to treat certain types of headaches, migraine headaches. It's also used to treat excessive sweating. So palms, underarms being the two big areas, because not only does it relax muscles, but that same neurotransmitter that the toxin attaches to also causes you to sweat. And so if you inject areas that are sweating too much, underarms specifically, we can turn off those sweat glands temporarily, and it's a great treatment for sweating. I think one of the second things that's important to know about Botox, but this one's really more filler related, is that fillers make you look fake. And that really could not be further from the truth. I'm a surgeon, I operate. The surgical community has kind of come out pretty hard against filler and people who are seeking to have facial rejuvenation surgery. And your traditional hyaluronic acid filler, so the gel fillers that are the most common ones out there that are used, are good treatments for early volume loss. And again, we talked about in a previous podcast, talked about the 4 components of facial aging, volume loss being one of them. And fillers do a good job at replacing small amounts of missing volume. You probably have seen a whole lot more good filler results out there when you're at the grocery store, when you're out with your friends, than you have seen bad filler. The bad filler jumps out at you. It's pretty easy to spot. Duck lips, these people that look alien with these big cheeks, these unnatural, blown out jaw lines. Those are easy to pick out. The good ones, which I would argue are far more common, you don't even notice. And so just because somebody suggests a filler doesn't mean you're going to look fake. That's something you have to talk about. Look at your injector first. If they look weird, that's a bad sign that they think weird is pretty. But talk to them about what you're looking and go slow. But fillers don't by themselves make you look fake. The injector does. The third myth that I've heard floating around the internet there is that things like Botox and fillers are permanent. And it's just not true. They're not. Botox and its equivalents, Dysport and Jeuveau, really only last about 3 to 4 months. You start seeing them slowly wear off over the span of about 3 to 4 months. And so the nice thing about that is that if you don't like it, it goes away and you don't have to do it again. Or if it looks weird, it goes away. I personally had somebody talk me into doing Botox one time in an area where I don't normally treat it, which is my crow's feet, and I ended up looking like the dude from one of the Marvel movies for about 3 months. And now it was Halloween, and I looked a little mean, and so it was kind of cool, but I haven't done it again. But, and I knew going into it that if it looked weird, it would wear off, and it did. Likewise, fillers are not a permanent solution to volume loss. They're temporary. Now, they're a lot longer lasting than the filler companies would have you believe. They tell you, 6 months maybe, 12 months maybe, year and a half maybe. There was a really interesting study that came out of France, mid 2024, where the investigators did MRI studies on patients who had had these HA gel fillers in Europe, and we're told that, they'd go away in a year and a half. And they saw evidence of filler in people's faces 15 years after their injections. And so these last a lot longer than you think they do. Little personal anecdote, I had a little filler put in my cheeks about 8 years ago. I've never had it done again. And I don't feel like I need it. Now, you may argue with me, but I really think that the HA fillers last a lot longer than they're sold, and is why when we're talking about facial rejuvenation surgery, I make a point to make sure that we haven't had filler done, certainly recently, but anytime in the distant past, because if you have, I can use an ultrasound, find that filler, dissolve it before surgery, so we have kind of a blank slate, we know what we're dealing with, and can replace that volume that's gone with your own body fat, which is a much more long-lasting, natural filler as opposed to an HA gel. The fourth myth out there, and I think this is really popular in terms of facial rejuvenation in general, is that only old people need it. And that couldn't be further from the truth. When I'm talking with patients in the office, one question that always comes up is, am I too young? Am I too old for whatever it is that we're talking about? And the answer really is no, because what we're really doing when we're talking about facial rejuvenation, when we're talking about either non-surgical or surgical treatments, is we're treating your anatomy. We're not treating your chronological age. There are young patients who have genetic early volume loss. They don't have high cheekbones. They don't have a lot of fat in the mid part of their face, and so they start seeing eye bags in their 20s or 30s. And we can treat that. Age really isn't much of an issue. Anatomy is. Final myth that I want to talk about today is that all these non-surgical treatments, toxins, fillers, are unsafe. And I think the easy answer to that is that they are FDA approved for specific uses. And while you can argue whether the FDA is the final arbiter on whether something is safe, they have to undergo very rigorous trials to prove not only that they're safe, but that they work for what the company tells you they work for. And here is where we really need to kind of take a little detour and talk about who's on the opposite end of the needle, who's doing the injections, because a lot of the problems from both toxins and fillers come from treatments that are either not really well thought out. Somebody's practicing, what I call Burger King medicine, where, you get it your way right away, and it may not be the right thing for you. And So you really have to, that's where, I spend a lot of time in the book talking about the importance of getting a solid diagnosis before you start treating anything. It's important that you and whoever it is that you're seeing have the same eye, that you understand, both you and they understand what it is that bothers you and what it is you're trying to treat before you start injecting or operating on anything. So, do you hear about complications from toxins and fillers? Certainly. Some of the most common things you hear about from toxins, swelling, which you're getting an injection, it's going to swell. Not much, but it's going to swell. You may get some bruising, which again, rare with toxin, but can happen. And the kind of the no-goes are if you're pregnant, we don't do that while you're pregnant, or if you have certain things, like a history of myasthenia gravis. If you have it, don't get Botox. And then with fillers, you can have reactions, although they're fairly inert. And so reactions to fillers are not common. Most often people complain about swelling. People complain about the filler being put in the wrong place. You can feel it. And, those things can happen. The nice thing about the HA fillers, there's an enzyme out there called hyaluronidase, say that 3 times fast, that can dissolve those fillers, and we can essentially get rid of them. So, to kind of wrap things up, this was a kind of a short show talking about myths and misconceptions about common non-surgical treatments, toxins, and fillers. I hope you found this entertaining, educational. If you have any questions, if you have any comments or have any ideas for other shows, DM me on Instagram at Dr. Jason Hall, shoot me an email, info@drjasonhall.com, and I will see you on the next show.